Achoo! Achoo!
Hi, how can I help you?
Well, I was sniffing some flowers and I started sneezing. I was trying to get some kind of medicine. I don't know which one.
Sounds like you have allergy and something like a nasal spray would help.
What's a nasal spray?
Nasal sprays are convenient medications for someone dealing with nasal symptoms of a common cold or allergies, like sneezing, stuffy nose, runny nose, or itchy nose. It is used for temporary nasal congestion relief, and it works by shrinking the nasal blood vessels that have become enlarged or irritated due to an allergen or in response to an infection.
In order to properly administer nasal spray, first use a tissue to blow your nose. This ensures the nasal passage is clear and the nasal spray can have optimal effects. Then, always read the nasal spray's directions. With the cap on, shake the nasal spray. After this, remove the bottle's cap and prime the spray by pushing out a small amount onto a tissue before nasal use. This is especially important if the bottle has never been used or if it has not been used in a while. While in an upright position, press a finger against one nostril to close it and insert the tip of the nasal spray into the other nostril, which remains open. Make sure the nasal spray is directed towards the back of the nose, not pointed towards either side. If the spray is pointed towards the center of the nose, you can experience irritation. Then gently squeeze the nasal spray while inhaling lightly with your mouth closed. Use a tissue to clean any solution that may have dripped from the nostril. Next, follow the same technique to squeeze the nasal spray into the second nostril. And again, use a tissue to catch any solution that may drip from this nostril. When you're finished, wipe down the bottle, ensuring it is clean and dry before securing on the cap and storing it for the next use. It is important to never share nasal spray with others. The nasal spray should be used once in each nostril once a day, unless instructed otherwise by your provider. If used for more than 3 days in a row, you may notice the nasal spray is no longer relieving your symptoms. This is called the rebound effect. With repetitive use, your body builds a tolerance to the spray, and it may become ineffective.
Use of nasal sprays can cause adverse reactions. Common side effects include bitter taste or smell, nasal irritation, sneezing, and runny nose. Some major side effects include change in heart rate, unusual sweating, tremors, and nosebleeds. If you experience these major side effects, discontinue use of your nasal spray and contact your healthcare provider. For storage, keep the nasal spray capped when not in use and at room temperature, away from heat, light, and moisture. Make sure it is also out of reach from children and pets. Disposal can be done through a local drug take-back program or using the mix, seal, throw method. First, mix the medication with either coffee grounds or kitty litter. Next, place it into an empty container and seal it. Then, you can throw the container away in the trash. It is also important to scratch out any personal information that are on your medication bottles before throwing them away.
In general, young infants and children under 1 year old should only use saline spray. Beyond that, the age restrictions depend on the product. You can check the drug facts label under warnings, which will let you know what ages are not allowed to take the medication. If you look at the directions section, you can see the dosing according to the different age groups. If you are still unsure, contact your physician or local pharmacy for guidance.